supposedly going to be the last week of the session. We could talk this morning about the 38 simple plan bills we passed. We could talk about the tax cuts that are pending. We could talk about the Revenue Stabilization Act, and I'm guessing most of you want to hear about what's going on with Medicaid. I think it's ironic that we're here on April 15th, tax day, to be talking about possibly the largest expansion of Arkansas government that we've ever seen. We will be taking up the Medicaid appropriation bill this afternoon. It's the latest words that I've gotten. I know there's a lot of people that spent time over the weekend at town hall meetings, visiting with constituents. My mind's made up how I'm voting on it. I have talked to several of my constituents, but I did have the opportunity to go down to Medina with Representative Bell this weekend, attend the town hall meeting. There were meetings in northwest Arkansas, and there are even meetings scheduled tonight in Saline County. I haven't heard a lot of shifting in votes over the weekend and talking to members. I've tried to stay in close contact with them. I know Representative Stephen Meeks has said that he's going to vote for the private option. He voted against the enabling legislation. I know Senator Rayford has said that he's going to vote for the appropriation. I believe he didn't vote on the enabling legislation. But other than that, I haven't got any firm confirmations one way or the other if people have changed their votes or they're planning to vote differently on the appropriation than they voted on the enabling legislation. I did post a white paper this morning on another option. It's been has to do with House Bill 1965 that I filed last week, or an amendment to the Shell Bill. This would be the Health Care Reform Act, and I believe it truly would bring sweeping reforms to the Medicaid system, not just the expansion population, but to the existing Medicaid population, except for the aged, blind, and disabled, which Medicaid was originally set up to address their health needs. I'll be happy to answer questions on that if you have them as we move further along. Again, today, though, I think the big question is how the vote on the appropriation will go, and what will be on tap for tomorrow, whether it passes or fails. I know people are saying that tax cuts are tied to Medicaid. I've argued against that the whole time. I believe tax cuts have to do more with future growth than they do with whether or not we pass a large Medicaid expansion. But we'll see how all that plays out as the week goes on, and I'll be happy to answer any questions.
You said your mind's made up on how you're going to vote. Did you hear anything this weekend that you hadn't heard before that was food for thought, or what's your takeaway from this weekend?
No, I think I've been close enough to the issue that I don't believe anybody's presented any new facts or data that make me think that the private option is the way to go. I still believe that right now that to reject the appropriation and reject the expansion is the best thing for the state, for my district back home. I do believe that if we had more time to vet this private option and to vet the option that I put out, that we might could come up with a better solution. But we certainly, I don't think there's enough certainty in either one of those plans right now that we should pass them and fund them at this time.
So the proposal that you're putting out today specifically violates the rules that the CMS memo had regarding private option style approaches. It also violates the law regarding Medicaid. So it's clearly dead on arrival from the Fed's perspective. Is this just kind of cover for a no vote and thinking about the ramifications of doing nothing?
And Davey, I think that's a matter of opinion, because I believe with the waivers that we could get the freedom to do what's proposed in here. If you remember, the private option has a pilot plan for health savings accounts, and if they're going to approve a pilot plan with the idea that that pilot plan could be expanded into the whole population, why would they approve a program that had a health savings account in it to start with?
But as you know, no cost protections below 100% of the federal poverty line would violate the law in a way that no waiver could get around.
And I think they would still have cost protections under the plan that I'm proposing. It would just require those participants in the plan to make decisions affecting their health care. They would still have 100% funding for their plans through the health savings account, but they could use that health savings account to help themselves move out of the poverty level that they're in through job training and education.
We're correct to assume that you, even if this bill was before the House today, you would vote no on your own bill as well, correct?
I would, because the bill hasn't been properly vetted, just like I believe the private option bill hasn't been properly vetted.
What hasn't happened? Vetted in what way has it not been vetted?
Well, we've got to get a lot of approvals from the federal government. You probably all saw last week where Kathleen Sebelius basically said she hadn't read the bill, and when she was asked directly, was she going to approve it, she said, no, sir. I'm not sure what that meant. She did follow up saying that her staff was working with staff here in Arkansas. So you got the issues with the federal government. I'd like for us to vet these plans with more cooperation from the federal government. We can get our federal delegation involved and get legislators more involved in the process of negotiating with the federal government. There are provisions in the private option that I believe we can't protect ourselves against. I know there are triggers in there that say the option, if the trigger's not met, the program would end. But take, for instance, the premium tax on the subsidies for those on the health insurance exchange. The federal government essentially would be paying not only the subsidy for the premium, but they'd be paying the fee on the premium. And I believe that's something that the federal government can cut out, and there's no protection.
How could Congress legislate what is a state tax on insurance companies doing business in the state that exists on the exchanges both in Arkansas and throughout the country?
I think they could legislate that they weren't going to pay that fee on the premiums because they're already paying 100% of the premium. And if they're looking for something
the insurance
to cut,
companies would pay for it.
but where the insurance companies get the money to pay the fee.
I mean, you could argue that the insurance companies are going to pass that fee on in the form of higher premiums, but the fee itself is paid by the insurance companies. I'm just asking, how could Congress legislate around that? I've heard that talking about what's in there.
Well, and I think you hit the nail on the head with the insurance companies could pass that fee on the premium, and the federal government is paying the premium. So why would?
But that's built into the projection from the analysis. I mean, that's built into the premium projection.
Right, it's showing $436 million of benefit to the private option over 10 years, and I'm just saying I think that's something that would be low-hanging fruit for Congress to take out.
So I'll try one last time, and then I'll let other folks go. You're saying it's low-hanging fruit, but you haven't articulated how Congress would legislate what is a state tax that exists on the exchange, both in Arkansas and throughout the country. It's impossible to me, but I'm open.
Well, I believe we all agree that federal law trumps state law, that they passed the law to say that they weren't paying the fee, that they were already paying 100% of the premium.
It's the insurance company paying the fee, but Sarah, sorry, I didn't. Were you about to?
I was just wondering if you're actually going to bring this before committee, or is it going to go straight to an interim study?
I'm going to run the 1965
Yeah.
before committee. Right now, I'm not planning to. I've gotten a lot of interest from other legislators that have actually wanted to sign on as co-sponsors. Like I said, I wouldn't propose that we pass this and fund it during this session because we haven't got enough time or had enough time to vet it. But if we wanted to start the vetting process by having a hearing on it in the committee, I would be open to that.
Are you surprised that Stephen Meeks switched position, and have you heard any other House caucus members who maybe are changing their minds?
I haven't heard of any others. I'm a little bit surprised that Stephen has decided to vote for it, but I think he went back and talked to his people in his district. He feels like that's what he needs to do to represent his district. I haven't heard of anybody else firmly saying they're going to switch. I've heard rumors of people that voted for the enabling legislation that may not vote for the appropriation. But I don't think the numbers have shifted dramatically since Friday.
Do you think that taking the break over the weekend helped, harmed, had no effect?
Well, I think it at least gave members time to go back and talk to their constituents. And I will interject here that had we not had Republican majorities, I don't believe we would have ever had this opportunity to go back and talk to our constituents. And also, we wouldn't have had the private option to look at. I think we would have come in and passed the fee-for-service Medicaid expansion, and probably wouldn't even be having this debate now. So the fact that people have looked for other options and they've looked for other ways to work through this problem, I think it's been more open and transparent, and because of that, members did get a chance to go back and visit with their constituents this weekend to try to explain this complex issue to them.